Welcome to the Catastrophic Comeback Podcast with American injury lawyer Clark Speaks, helping you find hope, purpose, and joy after a catastrophic injury.
Is there anything that jumps out at you about future technology that you hear about or that you think is in development process that may be available to our kids or grandkids or
Oh,
whatever?
for sure. There's so many amazing things that are coming out, either through genetic manipulation, different chemicals that are either growth factors or, the big buzzword is stem cells now. We hear that all the time.
Well, can you tell me what that means and how it applies here?
So stem cells, the basic concept behind stem cells is that when we're in the womb, we start off as one cell, and then we go into two, into three, and before you know it, you have enough cells that some of them start to become the heart, some of them start to become a kidney, some become a left eye. Well, before they get to that point of starting to branch off and be a specialized type of cell, they are pluripotential. They are a cell that can basically do anything. It could become a brain, it could become a kidney, it could become a fingernail, whatever it might be. And those cells have a lot of potential, pluripotential. And those cells also have a lot of growth factors in them. And so the thought is, okay, if we can get those cells and get those packets of chemicals out of them, those growth factors might be helpful for regenerating tissue or for helping heal a wound. For instance, we damage the discs in our spine, and there's no blood, no oxygen, no healing. That disc is damaged forever. What if we could just inject some stem cells or some of those growth factors, those growth chemicals into the disc, and it helps the new cartilage starting to form in the disc, and it could heal it? Yeah, that sounds awesome. We're not there yet. There are clinics all over the place that claim to inject stem cells or do inject stem cells or growth factors, but right now it's still the Wild West, in my opinion. There's not a lot of regulation. There's not a lot of oversight. We don't know exactly what's being injected, nor how good it is, whatever that product is. Do we need 5 million stem cells? Do we need 10 million? Are these stem cells that were collected from an 85-year-old man, which is probably not going to have too many good stem cells? Was it taken from a 15-year-old kid? Was it taken from a smoker or a non-smoker? There's so many variabilities. What tissue was it taken from? Was it taken from the placenta, from the chorion? It's all over the map. And I don't know. I don't have enough knowledge about that. I dabbled a little bit in the stem cell stuff and tried it on a few patients, and it seemed to work for a bit. I had a couple patients that had some knee issues. We injected them in the knees, and I don't know if they just wanted to please me and said, yeah, I feel better, or if they truly were. But they did say that at about the 6 or 7 month mark, the pain started to come back. But the reality is, okay, what if you give me 6 months of relief on my bum knee and I have to come back every 6 months? Okay, 2 injections a year, I'll do it. If I don't have to do a knee replacement or whatever, I think that would be worthwhile. It's obviously just a question of cost, and that's kind of all over the board too. But I think that's amazing technology. So stem cells, some of the genetic research that's out there, within my area of interest, just the different implants that are going in, new implants, different types of disc replacements. So there's different companies out there. You can kind of think of them as Ford and Chevrolet. They all do cars, but they do them slightly differently. And so there's different companies that do disc replacements for the neck or for the back. And some of them might be a little bit better for this, a little bit better for that. But it is really cool technology.
So one of the things that we deal with sometimes, especially in our catastrophic cases, is spinal injuries that might result in paralysis. We have paraplegics and we have quadriplegics and people that have dealt with some really, really life-changing experiences. And, a lot of times they're, some just different ages, young people, old people. And it's just like those people there is a massive impact on a person's life under those circumstances. Now, you and I have talked about the Spine Shepherd Center in Atlanta, and at least in my observation, is just a phenomenal place, and a lot of those people end up in the Spine Center to receive therapy. And it's funny, I was there probably 6 months ago, and I was talking to one of the people that runs that place about being on the podcast, actually. And I was there about my client and their patient as well. And this was a person who was paraplegic, and I was asking him a question or whatever. And it was what occurred to me about this individual is they didn't seem overly sympathetic, and I was kind of a little bit taken aback by that. And they were like, look, I mean, that's not what we're about. Mm-hmm. You get your sympathy somewhere else. We're here about making you understand that you can have a full, meaningful life, just not much different than you would have had. You know what I mean? Their job is to get you independent.
Pity party is for somebody else.
That's somebody
We're going
else's
to get you
job.
back in the game.
We're going to get you back on the field. And I was blown away by the fact that they were like, especially paralysis from the waist down. There is almost nothing. There are very few things that you could do before that you will not be able to do if you commit yourself to. And that was their approach. And I was like very, very impressed with the person with whom I was.
What's
speaking.
incredible about the Shepherd Center, Spine Center in Atlanta, and lots of these types of clinics, like you talk about, like Mayo Clinic up in Rochester, Minnesota, is there's a big emphasis on collaboration. It's not the spine surgeon. It's not the therapist. It's not the psychotherapist over there. They put everything under the same roof. And that's what's amazing about that is, you go to, I've only heard about it, but you go to Mayo Clinic and you come in there with some weird symptoms. I've got night sweats and fevers and I get blurry vision. Okay. Let's start off here. You'll first see the internal medicine guy. She's going to do her workup. They're going to send you for labs. But then she's thinking, you know what? I think you need to see the neurologist. Pop into the door next door. And the neurologist is ready to see you right then and there, not 6 weeks later or whatever. And that neurologist already has the labs that were done just an hour before. And they're thinking, you know what? I actually think this might be neurosurgery. Let me send you over right now to the neurosurgeon. The neurosurgeon has everything. Let's get the MRI right now. And by that afternoon, you're walking out with your diagnosis and a treatment plan. And that's like the Shepherd Center is, I don't know exactly, but that's what I've heard multiple times about Mayo Clinic. And what's amazing about that is the collaboration. You have all those people right there. They're all working together. They're all able to share their data or their information immediately. And you come up with a diagnosis and a treatment plan with a much broader, fuller view of the patient and what's going on, and a much higher chance that you're really getting the right diagnosis and the right treatment. Shepherd Center is the same thing. You've got spine surgeons, you've got neurosurgeons, you've got physical therapists, you've got massage therapists, you have internal medicine doctors, you have psychotherapists. They're really focusing in a collaborative manner to be able to get that patient whole again, not from just a physical perspective, but a psychological, social perspective. And I think that's what's great about places like that. You talk about like MD Anderson Cancer Center down in Houston. Yeah. They have that. They have the oncologist, the hematologist, the plastic surgeon to repair after you've cut off that body part and make it look good. They have all of that stuff all in-house. And I think that's what's great about those types of facilities. It's not, feasible to do that in every city and every town, but that's what makes those types of places stand out. And they're just amazing.
Can you envision a place in the future where permanent paralysis is a thing of the past?
We can put a man on the moon. Why can't we do that? Absolutely. It's just a question of committing the manpower and the resources and the research money to do so. The thing that your podcast viewers are going to wonder is, okay, what's the deal? Why can't you fix that thing? So the nervous system is, you have the central nervous system and the peripheral. It's just two separate systems, and it's all electrical wiring. So the brain and the spinal cord are the central nervous system. Where the nerves come out of the brain and then head to the ears or into the tongue, or shoot off from my neck and go off into my arm, or shoot off from my back and go into the leg, called the sciatic nerve. Those are nerves that are peripheral. They can actually be repaired to an extent. So say within my finger here, you'll have a nerve that runs along this side and another one that runs here. And not infrequently, we're manual animals. We touch our environment. We can injure our finger. We can cut our finger. You cut that nerve, and that's it. You won't feel on this side of the finger. You'll still feel over here, unless you happen to cut all the way across from one side to the other. But the nice thing about that nerve is you can repair it. You can sew it back together, or now they have actual glue where you just stick the pieces together. And depending on how healthy you are, that nerve can actually grow back, and you'll regain sensation in your finger there. The problem with cutting a nerve in the spinal cord or in the brain is once that's cut, that doesn't have the ability to regenerate. And we haven't figured out yet what is is it electrical reason? Is it a physical reason, like the wall around the nerve is different? Is it a chemical reason? There's certain chemicals that are out here that'll help the finger nerve grow back are not available within the spinal cord. That's an area that's we're still pursuing that we don't know yet. But that doesn't mean that we won't find it and figure it out. It's just a question of time. We've been able to figure out a lot of other healthcare puzzles. And I believe now, especially with genetic research, as well as better labs technology to be able to tease out different chemicals that we weren't able to tease out before, we'll be able to find that. We'll be able to find that solution to that. I hear or I've seen things where they don't necessarily fix the nerve, but now they'll give you an exoskeleton. They'll put the patient inside of like a suit of armor an Iron Man suit that actually moves and can move for the patient. It's absolutely fascinating. So there's thoughts of either, okay, let's actually fix the nerve, or okay, we can't fix the nerve. Let's build a new arm or a new leg for that person, a robotic arm or leg, so that they can continue to manipulate their environment, they can continue to walk, they can continue to interact with the world.
I would imagine that the progress of medical technology development is probably enhanced, increased also by artificial intelligence, and you can just you get down the curve and you learn more things more quickly through that technology. Is that fair?
I know very little about artificial technology, but the basic concept of being able to have a computer think as fast as a human brain, or now faster, and then be able to go through all different sorts of algorithms, absolutely. Like, when you're doing research now, before we wanted to find a therapy for a particular disease, we go ahead and get a bunch of plants from the rainforest and then isolate the chemicals out of them, the alkaloids or whatever they are, and see if any of them can be useful for a particular treatment. Now we can actually map what that protein is that might be missing in our body that we need for a particular process, and then figure out how to build that protein, or figure out how to actually see the genes that code for this protein, and then realize, okay, we're missing that one base right there, and that's what causes disease. Let's go ahead and go in there with this gene-altering protein that can go in there and basically just edit that one base, remove it, and stick the new base in there. It's absolutely amazing technology now, and it's really, they're using that technology to be able to address certain specific genetic diseases, and they're making fantastic headway. And it's only a matter of time, before we get to other diseases that are more genetically complex, and then we can address those as well. And by having supercomputers or super brains like AI, it makes sense that you can solve those problems that much faster and go through different shapes of a protein. Now you don't just think on your own, okay, I might want to change this shape. Now you're using the supercomputer to think of all different potential shapes that might be the best shape that works to solve this problem. Absolutely amazing. Absolutely amazing.
That's fascinating. Well, Dr. Bendiks, thank you so much for joining us. I appreciate you being here, and I think what you've said is going to be helpful to a lot of people. So thank you.
Thank you. It's been a pleasure.
Thank you for joining us, and we'll see you next time.